The Philippines has confirmed its first case of novel coronavirus. The Department of Health announced Thursday that a 38-year-old female Chinese national who traveled to the Philippines from Wuhan, the Chinese city where the coronavirus outbreak originated, via Hong Kong tested positive for the virus. She arrived in the country on January 21, the DOE said. The DOE further disclosed that she consulted with a doctor after experiencing mild cough. She is no longer exhibiting any symptoms of coronavirus infection. DOE Secretary Francisco Duque III confirmed to CNN Philippines newsroom that the woman has been confined at the San Lazaro Hospital in Manila, a special national hospital for infectious diseases. We are working closely with the hospital where the patient is admitted and have activated the incident command system of the said hospital for appropriate management, specifically on infection control, case management and containment. We are also implementing measures to protect the health staff providing care to these patients, Duque said in an earlier press briefing. Further, Duque told Newsroom that the Chinese nationals admitted in San Lazaro Hospital were put in isolation. They are in isolation room, absolutely sealed off from anybody, except the health care workers taking care of them, and they are in their full gear, the health chief assured. DOH Epidemiology Bureau Director Ferchito Avellino said they are also looking at places where the woman stayed in Cebu and Dumaguete. He added that they are working to identify and quarantine employees at establishments who had close contact with the woman. Avellino also said they are also working with the Bureau of Quarantine to determine what flights the Chinese woman took to the Philippines. He said they will track down the 4 passengers nearest to the front, back and sides of the patient, contact them and advise them accordingly. The Philippine National Police has vowed to assist the DOE in monitoring all major entry points in the country. It said that local police are also on standby to track down other people who may have been infected with 2019 nCoV. The city government of Manila will also distribute around 400,000 face masks to students in public schools in the Philippine capital, Mayor Isko Moreno said. We ask the public not to panic and to remain calm as the government, especially the DOE, is on top of the situation, Presidential Communications Operations Office Secretary Martin Andener said. We would like to assure them that the relevant health, research, and law enforcement agencies are working together to prevent the disease from spreading. Travel ban sought. The DOE said that it is now investigating 29 people suspected of 2019 nCoV infection. 18 of them are in Metro Manila, 4 are in Central Visayas, 3 in Western Visayas, and 1 each in Mimaropa, Eastern Visayas, Northern Mindanao and Davao. One person who had been under investigation for the coronavirus has died of pneumonia. Health officials said that the 39-year-old man has not yet tested positive for 2019 nCoV, but has tested positive for HIV, which if untreated can leave the body susceptible to all kinds of infections. Duque said he will recommend to the Task Force on Emerging Diseases to ban the entry of all travelers from China's Hubei province, where Wuhan is located. But I believe that will still change. It could expand, increase the number of places depending on the assessment that is going to be done by the WHO, World Health Organization, he said. Some areas in the country have enforced stricter entry rules, with Samal Island in Davao del Norte barring entry of all people who came from countries which have reported cases of 2019 nCoV. Cebu, meanwhile, is seeking to enforce a 14-day quarantine for tourists coming from China. Some lawmakers are also calling for the government to temporarily ban all people who came from China from entering the country. Among them is Senator Riza Hontiveros, who wants a 30-day travel ban on all individuals traveling to the Philippines who passed through China in the past 2 weeks. The DOH advised the public to practice good hygiene, drink lots of water, eat food rich in vitamins A, C, E and the mineral zinc, avoid crowded places and to wear a surgical mask if they feel any flu-like symptoms. Some of the common symptoms of a 2019 nCoV infection are headache and weakness, runny nose, cough or sore throat, and muscle pain. It may also cause high fever, trouble breathing, pneumonia, sepsis and even death. For more update regarding the coronavirus, please subscribe MJ Vlogs to keep you updated. Take care all and God bless.